Good morning, students. Our today's topic is patient medication history interview. First of all, we should know what is that. It is nothing but the information of medication what patient have taken from previous time, from last 1 year, whatever medication he have taken, whatever vaccine he have received, whatever allergic reactions he occurred, whatever drugs he have taken in last period of time, so that all the information we need to be gathered from the patients, and for that purpose we are making an interview. We are asking the questions in the form of questionnaires to the patients, and we are grabbing out all the information regarding the medicine, regarding the allergic reactions, regarding any body responses for that typical type of disease or medication. So it is nothing but the patient medication history. Medication history interview. A medication history is a detailed, accurate, it should be accurate, complete account of all prescribed and non-prescribed medications, not only prescribed but also non-prescribed medications that a patient had taken or is currently taking prior to a initial institutionalized or ambulatory care. So whatever number of drugs he have taken during hospitalized or ambulatory care, means when we are going towards doctor, we are getting prescriptions and the drugs has been dispensed to us. So it is called as ambulatory care. So by which whatever drugs we are taken and the information we are collecting, it is nothing but the medication history. It provides valuable insights in the patient's allergic tendencies, by which we are getting the patient's allergy informations, means for which drug patient is having allergic reactions, for which food, for which conditions, for which time, or for sunlight. So whatever things are responsible for producing allergic reactions, that we are knowing by this medication history interview. And also we should know the adherence, means to which drug the patient is having good compliance, is having good adherence, means the patient is taking that drug properly without any hindrance, without any obstacles. So patient adherence is also very important to pharmacological or non-pharmacological treatment, and self-medication with complementary and alternative medicines. It not only includes pharmacological but also includes non-pharmacological, and also includes the alternative medicines or any traditional medicines, any conventional medicines, anything which you are taking from domestic level. It may be turmeric, it may be neem, it may be uh, it will be tulsi, it will be amla, whatever number of things, or food atoms, or anything which we are taking from the history times, from the conventional use we are taking. Interviewing a patient in collecting the data of medical history is called as medication history interview. So by this way, whatever data we are collecting, it is nothing but the medication history interview. Now, importance of accurate drug history. Why it is important to have a accurate drug history? Because whatever information we are providing to the physician or doctor, on that basis, the doctor will prescribe the next medicine. So, doctor must know the exact information of medical history. For first point, preventing prescription errors and consequent risk of patients. If physician already know that this medication or this antibiotic is allergic for the patients, is producing some adverse effects, is producing some drastic side effects. So next time the doctor will take care of that things, and he won't prescribe the same drugs. Or by keeping the medication history of patients or allergic condition of the patient, he will prescribe the appropriate drug. So first point is very important, preventing prescription errors and consequence risk of patients. Useful in detecting drug related pathology. If any pathological conditions the patient is going with that, for example, if patient is having the conditions like increased blood pressure, or if he is having anemic like condition, so any pathological parameter, he is having up and down. So in that cases, in the pathology or changes in the clinical science, that may be result of the drug therapy. So we should be pinpoint that if you are having any either issue in your body, any complications regarding health, regarding pathology, regarding our sugar level, if you are having high sugar level, if you are having the high lipid level. So these are the consequences, pathological reports, which we should go with. It should encompass all currently and recently prescribed drugs, previous adverse drug reactions, and include herbal or alternative medicines and adherence to the therapy for better care plan. It is very very important that what drug currently the patient is taking, and if he was having any adverse effects regarding past medication or not, and to which medication, whether it is herbal drug or it is alternative drug or to any allopathic drug with which he was having that adverse drug reactions, and with which drug the patient is comfortable, the patient is having good adherence. What is adherence? With drug he is comfortable, he is taking that drug for longer period, or the as per expectation of the doctor prescribed 10 gram and the patient is 10 gram of drug with the whole therapy, means it is having good adherence, 100% of adherence. So that is also very important to develop the next therapy plan. Goals. What are our goals? The goals of medication history interview is to obtain the information on aspects of drug use that may assist in overall care of patients. This is very important. If you are not asking the medication history and you are blindly giving the drugs, it will become life threatening also. If patient is having allergy of penicillin and if you are giving penicillin, it will produce anaphylactic shock. If patient is having allergic reactions for any antitubercular drug, if already kidney is damaged, in if you are giving the drug which will affect on your kidney, you are not asking medication history or pathological history, so person may die due to that drugs also. These things already happen in history. That's why we must collect all the informations regarding the medication history. The information collected can be utilized to compare medication profile. We should compare its medication profile with medication administration record and investigate the discrepancies. We must investigate the medication administration, means whatever drugs the patient is has been taken, and during that period, if any discrepancies, if any variation into his treatment or any reactions was occurred, if any side effect was occurred or not, so how the treatment have cured the patient completely, in what way, in what rate, so that all these things we need to be investigate. Verify medication history taken by other staff and provide additional information where appropriate. Don't rely on the other staff. So you need to be yourself, you should investigate again the medication history, you should check the details by asking question to the patients, or again evaluate their family members, or another way you should again investigate, you should investigate the reports, what was the actual reports, whether you have all the reports regarding git, regarding brain, regarding kidney, regarding any other set of biopsies which you are having report. So investigate again what drugs was suitable for that in history. Accordingly you should give the drug for current situation, for current conditions. The following information is commonly recorded. These are the various 7 types of informations we are commonly recording. In that, first is currently or recently prescribed medicines. What medicines is patient is consuming right now. The second point is OTC medications. Sometimes we are taking the medicine OTC, over the counter medicine, for the purpose of pain or inflammation or anemia or acidity, for relieving our depression, for relieving our fever, for sneezing purpose, for common cold. there are n number of cases for which we are taking these OTC medications. So we need to be uh, keep some record of these drugs, which drugs were taken from last period of time. Next point is vaccination. From the recent period, from last one period of time, whatever vaccination, if you are taking any vaccines, you need to be record. You should remind that which vaccine we have taken for the typical any infection. For example, if you are taking any vaccine for pneumonia, or recently developed Ebola virus vaccine, or still the lots of research is going on this COVID-19. If it will develop, so it will you will take in September or October. So if you have taken any vaccine, so you should tell to the doctor. Next point is alternative or traditional remedies. Sometimes we are bypassing the allopathy and we are going for any alternative therapy. For example, we are going towards Ayurvedic therapy or herbal. We are going for the homeopathic therapy or naturopathy, or Unani or Siddha, or we are going for the yoga. So we are going for the another traditional remedies or alternative remedies which are better as compared to the allopathic, because we all know allopathic drugs are having lots of side effects, and we have to take the drug for a whole your life. We should not stop. Once we stop, it will produce the problems. Description of reaction and allergic to the medicines. So in history, whatever allergies and whatever allergic reactions has been developed, what sort of reactions has been developed, for which drug it has been developed, and whether it was very serious or not, or for how much period it was remained into your, the reaction has been evoked into your body, and what remedy was responsible for that. If any food was there, so you should recall all these things, and you should give in written form. Medicines found to be ineffective. Yes, it may also happen if two peoples A and B, if both are having same infection or same complication, and if you are giving the high drug or proper drug or effective drug for both peoples A and B, it may be chances for A it will be effective, and in case of B it won't be effective. For example, suppose in case of typhoid, if you are Cipixim, if you are giving Cipixim 500 mg to both in divided doses for 3 days or 5 days. So for A it will be efficient, but for B it won't produce any effects. It may be there. So that you need to be identified. So in history, which drug was ineffective for which infection. That will be also another guideline for the prescribers to prescribe that drug next time. Adherence to past treatment and use of adherence aids. So in from past history, how we are adhered to the treatment and to which drug we are adhered, because this why we are adhering to drugs, because we are feeling comfortable with that drugs, we are taking that drug properly because we don't have any complication with that. So that adherence we need to find out from the past period, and you should go with the same drugs in future also, because they are compatible with you, they are not producing any side effect. It may, there may be chances that they are A and B persons. If a person is taking that drug from last 1 year, 2 year, 3 year, but you don't have any complication, but if same drug will taken by the B person, and he may develop some complications, he may develop some adverse effects or side effects. So in that case, he won't have good adherence to that therapy. In that case, doctor will change the drugs. So in case of A, this drug is good, this drug is having all the numbers, but in case of B, there is no adherence. So that's why you should go with the drug which is compatible to your body, because each and every person is having their different genes, their different genetics, and accordingly we are accepting the therapy or accepting the molecule. So there is variation between one person to the another person. There are various information sources. There are 6 types of sources for this information from where we are getting the information of medication history. First, and the ideal one, it is the supreme source, it is patient itself. So from patient we can ask the questions regarding his medication history. We are developing some questionnaires. There are a number of questions, and we are asking the questions. Some are in objective form, some are in yes or no form, and patient have to answer that. And we write down all the answers, and accordingly we will develop our idea. Next, family members. Yes, family members are the having the very great role into our treatment. They are not only supporting by giving us drugs, but they are giving us the moral support. They are changing our psychology. That is very important. That's why if you are in family, you will cure not only with drugs but also with your psychological environment. So family members like mother, father, our sister, wife, our daughter, our son, so they will take care of us, and they will give the information to the doctors or physicians or clinicians and caregivers. So they are professional skilled persons. They are also providing these healthcare services. There may be nursing staff, or there may be the healthcare providers like ward boy, or there may be the clinicians, or there may be the pharmacist. They are providing the informations. Their group of 2 3 people or one nursing staff will be there. They are reaching to your home, your native place, and they are providing the services. So they are also giving the information. Third point is medication vials and bubble packs. Means whatever number of medication vials which you are used, so they are also giving the informations. If you collecting that vials or ampules or any bubble packs or blister packs, so they are also able to give the information. Next point is medication list. We had to enlist the all the prescriptions which we have dispensed in last 1 year or last period of time. So we have to make the list of all the drugs. Either it may be antibiotic, it may be antacids, whatever drugs they are which you have consumed in last period of time. So you have to make the list of that. It is nothing but the medication list. From that also we are getting the information. Community pharmacy. There are few numbers of community pharmacy from which the drug has been dispensed to you, drug has been reached to you. There are various types of community pharmacy. In that, first is private medical shop from which drugs you are getting. Second is the various government organizations, for example, primary healthcare centers or civil hospitals from which you are getting the drugs. After that, the ASHA workers which are providing the drugs from the government hospitals towards you. They are reaching towards your home. They are coming towards you. After that, the nursing staff, they are also coming towards you at your home, and they are giving you the drugs. Next is private hospitals. Next is the private clinicians, but they are reaching towards your home. Doctors are visiting towards your home. After that, the private clinics where you are approaching, where the patients are going, and the pharmacist when they are coming towards you, according to the community pharmacy. So in this fashion, there are n number of ways by which community pharmacy is dispensing drugs towards the patient. Now DPIN, DPIN drug, it is nothing but the Drug Program Information Network. It is the electronic online system for drug purchase, and they are having all the information in tabular form. They are having information of patient's name, their age, their body, their sex. After that, what drugs they have consumed and for which purpose they are consumed. So it is the electronic information center, and which is not developed in India, but it is developed in some countries like US, Canada, like UK. It is very good system if you will see. Nowadays, you might be aware of that there are some service providers like Pharmacy or like Netmates. So these are the service providers. So they are just like that. So they are providing the drugs online. Now the lots of medical shop owners, they are against this, but it is good thing because you are getting the drugs at less cost, and the actual drug which we want, which brand we want, which chemical name drug we want, that we are reaching at our home, and we are also giving the prescriptions to them. After this, questions. This is very, very important. It is the soul of our presentation, because we must know what question we will ask, because by asking these questions only we are getting the exact information of medication history. In that first question, which community pharmacy do you use? Recently, I told there are 9 numbers of community pharmacy by which we are getting the information, by which we are getting the drug. So, from which source you are use that drug? Either you went to the medical shop, or any ASHA worker, or any nursing staff, or you are getting from the hospitals, government hospitals, it may be from the private hospitals, like that, from clinicians, physicians, so like that. Next is any allergy to medications, and what are the reactions? Means in from past history, if any allergic reactions was developed into our body due to any drugs, due to any conditions, due to any food, due to anything, any water also sometimes. So anything, if any climate, so whatever things has produced any allergic reactions, and what was its reactions, so that, and for how much period or how much days it was continue, if any relapse was occurred or not after you are continuing that drug, or you have again taken that drug, so that all the information you need to be checked. Which medications you are currently taking, what is the current medication we are taking. Next is the name of the medication, what exact name, means its biological or chemical name, you need to be ensure, you should be tell to the physician. After that, what type of dosage form we are using right now, whether it is in tablet form, in capsule form, in injectables, in intramuscular, intravenous, or in saline forms, or in the intradermal patches forms, or it is intrarectal form, or it is intravaginal form, or it is through inhalations form, or through intrathecal route you are taking that drug. So what is its form? So according to their form we are taking the drugs. So you should ensure, you should tell the exact form of the doses you are taking. The amount, what specific amount of drug you are consume, or you are consuming, that you need to be tell, either it is in case of 10 mg or 100 microgram, or in 5 ml or 2 ml, half ml. So you should write the specific dose of that drug, which dose you are taken or you are taking, how are they taking it, so by which route you are taking. So either you are taking by oral route, or you are taking by intradermal route, subcutaneous route, intravenous route, or you are taking by intrarectal route, or intravaginal route, or through inhalations, respiratory route, or we are taking through intrathecal route. So by which route we are taking that drug. So in this fashion, we must always ensure, we should record by which route we are taken and keep in our mind. And we should give the exact information regarding the medication history. How many times a day? Means frequency. In one day, how many times we are taking the drug? For example, 3 times a day, sometimes 4 times a day, 2 times a day, once a day, at night only, in the morning only, if in case of only in complications, if you are having headache, in that only you are taking the drug. In case of only morning sickness, in case of pregnant lady, they are taking the drugs in the morning. So accordingly, what drugs in which frequency, in which quantity you are taking, that you need to be ensure. For what reason? This is also very important. Either it is for any infection, either it is for any body complication, it is for hypertension, or it is for diabetes mellitus, or for pain you are taking, if you are having acidity, for that purpose you are taking, or in case of any scissors we are taking. So there are n number of reasons for which reason you are taking that typical drug. So you should recall, and by that way you should tell the exact reason for the typical drugs. What prescription medication are you taking on a regular basis or as needed basis? Yes. So there are two parts: regular basis and needed basis. Next question is, what over the counter medications you are taking on regular basis or need basis? So first of all, you must know what are the drugs for regular basis and need basis. Regular basis means the drugs without which we cannot survive, we cannot live. We have to take the drug at mandatory level, daily you have to take. So in that case, the condition like diabetes mellitus, the condition like epilepsy, the condition like tuberculosis, condition like arthritis, in arthritis also I take drugs daily. In condition like hyperlipidemia, in condition like arrhythmia, in condition like now nowadays it is very common in anemia or for acidity. Some people are having daily acidity, some people are having daily pain, nerve pain or muscle pains, muscle spasm, body pain, headache. So sometimes we are having daily, we are having this problem, so they are called regular basis. And need basis, in case of sometimes we are having headache, sometimes we are having pain, not daily, sometimes we are having pain. So we are having some typical infection, for example we are having the malarial infection, we are having the streptococcal infection, we are having some fungal infection for few months or few days only, we are having some infections like cholera infection, we are having the infection like we are having dysentery. So like that, it is for time being, for time being it is for need basis, and it is lifelong or for a period of time, for 1 year, 2 year, 3 year, or 5 6 years. So it is for regular basis. So as we know, there are two categories. So what prescription medication we are taking on a regular basis and need basis, you need to be distinguished, you should list both. After that, over the counter drugs, out of them which drugs we are taking daily on regular basis. There are certain drugs which we can take daily over the counter. For example, we are taking drugs for headache or body pain or muscle pain. Now in case of arthritis also we are taking pain. So there are, I saw some people who are taking in combination of paracetamol plus ibuprofen daily, they are taking for arthritis. After that, I saw some people who are taking the sildenafil. It is the drug which can be used for the erectile dysfunction. So they are taking daily at night after their meal, after their dinner. So there are certain people who are taking these drugs over the counter regularly, and sometimes we are taking the drugs over the counter on only when you are needing, when you are having headache once or twice, or we are having pain or acidity. If sometimes we are having, so on that basis we are taking the drug. Now, what herbal or natural medicines are you taking on regular or need basis? There are also certain herbal or natural medicines which we are taking sometimes regularly. For example, I am taking the tulsi daily. You can also take. It is good immunomodulator. Also, we are taking some. There are certain drugs like turmeric. You may take sometimes on need basis. We will apply turmeric on our wound, which it is having good, very good wound healing property. So you can decide when you are taking on which basis you are taking that herbal drug or natural drug. What vitamins or other supplements are you taking? So nowadays, as we know, all the vitamins we are consumed or we are consuming. First of all, it was told that vitamin C you should take. After that, B complex. After that, nowadays they are telling that vitamin D also required for your to fight against COVID-19 to build up your immunity. So certain types of the things has been researched by the scientists, and they are published, and the various recommendations or various notification has been passed by the WHO, and we are accepting them and we are following. So what types of vitamins or any supplements, for example, in case of any scarcity in body, means you are less sodium intake or less sodium is there in your body, so we are giving the sodium from externally or calcium from externally if in case of osteomalacia. So like that, what rare elements or what vitamins or what trace elements you have taken in last period of time, that you need to be insured. Have you recently started a new medication? If you are having any new complications, for that, suppose if you are having therapy of hypertension from last 4 to 5 years, and you are developing a recently new fungal infections, so for which you are started a new therapy. So you need to give that information also, that from last 2 days or from yesterday I have started this drug. Next question is, did a doctor change the dose or stop any of our medication recently? In this case, doctor may change the dose or stop. Why he will change the drug? Because if the patient is having any complication, if patient is having any adverse effects or side effects, in that case, doctor may change the drug. In case of infection also, if that antibiotic is not able to cure the patient, in that case, he will give the alternative antibiotics. It will be better or another antibiotics. Same case in case of this patient also, if patient, do you change the dose or stop any of your medication recently? In case of patients, sometimes patient think that I am not satisfied with these drugs or it is not good for me. In that case, the patient may change the drug. He will ask the doctors, and doctor will change the drug. Or in some cases, if he is having lots of problem with that drug, so the doctor will tell to stop that medication, or the patient will stop the medication by itself if he is having very severe problem of that drug. Next question is, are any medications causing side effects? There may be chances to produce the side effects. So you should know that which drugs have produced which type of side effects, and you should write it down that this drug have produced these side effects. It was one of the side effects produced by this drug. So there are some chances. Have you changed the dose or stopped any medication because of unwanted effects? There are also some cases where we are getting the unwanted case or unwanted effects, due to which doctor have changed the dose. Sometimes doctor is giving the alternative also, and in the worst condition, if it is uncontrollable, in that case we have to stop the medication, stop the drugs for that therapy. Next question is, do you sometimes stop taking your medicine whenever you feel better? Yes, this always happens. There are 70% people, 70% patients are there whenever they are feeling good after the initial therapy, and they will stop the therapy. It happens. Now I will give some example. For example, in case of respiratory disease, we are taking the azithromycin, and azithromycin 500 mg we should take 3 tablets in their dose, or 250 gram 250 mg in 6 tablet divided to 6 doses. But when you are getting relief within initial doses, 1 or 2 tablets, then what happens? We are thinking that we are completely cured and we are stopping therapy. But you should not do that. You should complete the course, because whatever bacteria is there in our body which is responsible for producing this pneumonia or producing this respiratory syndrome, so they can be killed. But we are thinking that we are feeling well and we are stopping, but it is not good, because sometimes the patient may be become asymptomatic, but they may become the carrier. The bacteria is in their body, so we should kill completely. We should complete the course. At any condition, you should complete the course. Do you stop taking your medicine if it makes you feel worse? So yeah, this may also happens. If you are not compatible with that drug, if drug is producing drastic side effects, adverse effects, they are difficult to take, we are not having good medication adherence, so in that case we can stop the drugs. So if you have stopped that drug, you should tell that name of drug to the doctors, to the physician, so that next time the doctors will not prescribe the same drug for the same type of condition, same type of infections. Now, this is the form. This is the patient medication interview form which you need to fill at the time of the physician is visiting towards you. There are certain information which you need to fill in that. First is date, date of that information taken by the physician. After that, name of the patient's last name, first name, middle name. After that, patient's ID, if any ID is there, means if he is having any occupation. Date of birth. After that, height, what is the height in inch or centimeter, or weight in lbs or kg. Here the site at which site he have visited to the doctors. After that, name of the prescriber, the name of consultant or physicians, phone number of physicians, fax number, pharmacy name and pharmacy phone number. Next information is allergy. This is very very important. What allergy the patient has developed from last medication, and from which drug the patient have developed the allergy. Either it have produced by the penicillin or sulfa drugs, or if any other drug is there. After that, food. So which food have developed that allergy? It may be sulfite or shellfish or any other food. So if any food have developed that allergy, you should ensure that drug. You should write that drug name here. So what medication history the patient was having? In that you need to be ensure that. In that, first is anemia. If patient was having anemia, you should give tick mark here, anemia. Or if patient is having asthma or atrial fibrillation in case of arrhythmia, chronic renal failure, constipation or COPD. After that, coronary artery disease, depression, dermatophytosis. It is one of the skin infections that can be transferred from one person to the other person when we are coming in contact, direct contact. And it can be developed through our skin, especially on head, on scales, where the scales becomes very dry, skin become very dry, and due to which the hair loss will occurs, baldness will be occurs. It can be developed by some worms like ringworms. Ringworms are develop this dermatophytosis. After diabetes, DVT, gastric ulcers, like that there are n number of medical history conditions the patient was suffered from last 1 year. And if apart from this, if any other complications were developed, you need to be right here in this box. Most recently laboratory values are the date of lab drawn, so on which day you got this laboratory report, pathological report. In that, sodium level, potassium level, glucose, creatinine, and like this. After that, complete the blood count in that hemoglobin. After that, WBC, RBC, hematocrit, platelets. So you should write with the dates on which date we are having and what was the reports of that. It's numbers. Same thing for liver function test, coagulation, lipid panel, after that thyroid panel. So in this fashion, the vitals, BP, if any person is having blood pressure, increase, decrease, hypertension, diabetes, if he's having any sugar, increase. So in this fashion, the whole information you need to be right here. It is a complete form which gives all the information regarding the patient's drug level, the date of lab drawn, and labels and goals. And MTM, you should write the name of clinic here and the specialist name and phone numbers. So in this fashion, you should write the complete information of your patient's medication history form. So students, I hope you understood my whole lecture today. So for today, this much is sufficient. So next point we will see in next lecture. So goodbye for today. Have a nice day. Bye.